forget. Perfect. Well, welcome everybody. I am thoroughly enjoying this series of talks today, and I hope you are too. And we are very lucky to have here with us right now Laura Bozman, who, for full disclosure, is my fabulous sister-in-law. And Laura is a clinical aromatherapist and massage therapist in Leicestershire in the UK. And I do want to let everyone know, because I think this is such an amazing thing. She is currently up for the UK's National Wellness Therapist of the Year, and she came third last year, and that is third in the UK, everybody. So we are talking to a pro.
Yeah.
Yes. So Laura has been doing aromatherapy and massage for several years now, and she's also taught quite a few baby massage classes, helping moms bond with their babies and helping relieve some of the things that can go along with newborn issues. So Laura, I'm going to turn it over to you. I'm sure people are going to have a lot of questions, so put them in the chat for me and I will get them to Laura. So Laura, let you get started. Thank you so much.
Oh, Helen, you're welcome. So my name's Laura. I'm a clinical aromatherapist and massage therapist based in Leicestershire in the UK, as Helen said. So before we delve into how essential oils can help you, I think it's important that we take a little step back and we get an understanding of what an essential oil actually is. So to put it simply, an essential oil is a fragrant, volatile molecule, and it's easily evaporated. And it produces a lovely, beneficial liquid known as the essential oil. They can be extracted from plants. So the most common methods you would find is steam distillation, cold pressing, and maceration. There are lots of other ones, but they're kind of predominantly the most common ones that are used. So these molecules, they're usually divided into 3 separate groups. And this is just to organise their therapeutic qualities. So you may have heard of some and you may not. So we've got the top note, the middle note, and the base notes. And this helps distinguish what type of oil to use and which ones to use in a blend. So top notes, they tend to be lighter molecules. They evaporate first. They tend to be kind of more of an uplifting, more zingy, more energizing. So these kind of go with the more citrus type of essential oils. So mandarin, lemon, lime, all of the citrus oils really. Then we've got middle notes, and these kind of do what they say. They're in the middle there. They're the in-betweens, and these tend to lend themselves to be more balancing essential oils, so good for hormone balancing. They do have a wider range of therapeutic benefits because they go across the middle. We can touch on those a little bit later. But typically, like lavender is a really good middle one. Depending what blend you use it in, you can use it as a top note, but predominantly it's used as a middle note. And then lastly, you've got base notes. So base notes, they are heavier, they're thicker, they hang around a lot longer. So after you've smelt the initial top note, what then kind of comes through is the long-lasting base note, and you can carry on smelling that for a good 24 to 48 hours. You will find that they are mostly calming essential oils. They are sedative, and good base notes are frankincense, sandalwood, and vetiver. So when you've picked out a blend of essential oils and it's got more than one in there, the first oil you normally smell is the top note, and that's because it's released first. It's the lightest molecule. And then you go through the middle note and you go through to the base note. And depending what you want from an essential oil will depend on which oil you choose. There's so many, and there's lots of different oils to use for different things. So I'm going to move to slide 2. So top 10 ways to use essential oils. Like I say, there's lots of different ways to incorporate them. These are probably the ones that I use the most, and the ones that I advise clients to use the most if they want to use them. So we'll start with aroma stones. Now you can't see it, but I do have one in the back there. It's something you plug in, and it's like a little blue dish, and you just add maybe 4 drops, 6 drops of essential oils, and the electricity will warm that plate, and it will gently and slowly release the molecules. So it doesn't get too hot, and you don't have to worry about it being on for a long period of time. Especially if you've got like little ones at home, you don't have to worry about candles and flames. Next on the list is water diffusers. Now these are quite popular, and you'll often see them on adverts with the kind of white steam vapors coming out. And these are the ultrasonic plates that they use there. So typically you add water, and then you add your essential oils. You'd probably use a little bit more, 10 to 12 drops. The only thing I would say about the water diffusers is that you have to clean them. So if you're using them every day, you'll get an oil residue buildup. So if you then don't clean them, then that kind of taints the next time that you use it. So it does have to be cleaned thoroughly. Pillow sprays, I love a pillow spray. There's lots of DIY recipes out there. I would only say if you're not going to use like a preservative, or if you use like a distilled water and an alcohol to mix it with, just make sure you always give it a good shake, especially if you haven't used it for a good couple of days, because that essential oil will come right to the top, and you'll end up just squirting like the water of the alcohol out, not the actual essential oil, as they don't tend to mix so well. And that kind of leads me on to baths. So if you're somebody who likes a good long soak in a tub, using essential oils here is a great way, especially if you've got muscular aches or pains. You can use them with Epsom salts. You can use them in like a foaming bubble bath type way. But I do have to kind of say, on a safety note, essential oils are not soluble, water soluble. So what that means is if you pour it directly into your bath, they will sit on the top of the surface of the bath. So when you're in there having a nice soak, actually, the essential oils, the neat essential oils, are going right onto your skin, and that can cause a dermal irritation. So you might think you've had a reaction to the essential oil, but actually it's the way that you've used the essential oil. So if you're looking to make your own sort of bubble bath, or you want to use it, make sure you use it with a dispersant. And all that means is it's a product called a polysorbate. You can choose between a polysorbate 20 and a polysorbate 80. I personally use polysorbate 80 just because it's derived from coconut and it's a bit kinder to the skin. Now, you might think it's a bit odd that I've written toilet rolls on the list. This is a super easy thing and everybody should do it. All you need to do is pop literally 1 or 2 drops of essential oil on the inside of your toilet cardboard. And each time you then get some toilet roll off, it kind of spins it around and it disperses that fragrance. And it just makes your bathroom smell really nice. Super simple. So from one stinky place to another, the kitchen bin or your trash can. So when you're emptying your bins, you can either place a cotton pad at the bottom. You can get like recyclable ones that kind of wear and you just wash and keep using them. Or you can stick it to like the lid of the bin, and just again using neat essential oil, add a couple of drops, and it just then makes your kitchen smell really nice and not like a stinky bin. Again, with the neat essential oils, I've put pillow drops down. Now, if I struggle to sleep, I have a lovely pillow spray, but sometimes I just want something a bit heavier, a bit more heavy duty. So I'll often pop a drop of essential oil like on the corner of my duvet, because I kind of bring it up to my cheek or my chin, and then I can kind of get those waves throughout the night of the scent. But I would say, depending on what material your duvet is or your pillow is, do check, because obviously you don't want it to stain or ruin it or anything like that. Next, laundry softener. Now, I don't use your conventional like fabric softeners. I do use white vinegar, and a lot of people go, oh my God, why are you using white vinegar? Your clothes must stink like vinegar. I promise they don't. Now, through work, I go through a lot of towels, and white vinegar and washing soda are the best things to use. They make it super soft. It's less chemicals, stops affecting the endocrine system. That's a different topic for a different day. And I tend to add essential oils to the bottle of the vinegar, and I just pour it in as I would fabric softener, and it keeps it nice and soft. If I am like super prepped, sometimes I will save the orange peels that we have, store it in the freezer. I'll get a Kilner jar. I'll fill the Kilner jar with oranges or lemon peel, top it up with vinegar, and I will let that kind of soak for 4 to 5 days, and then that comes out a really nice citrusy vinegar. I promise you, I use it, I've been using it for years, and it's a good swap, an easy swap. Still talking of laundry balls. I've got these white woolen ones, and the idea of the balls is that it disperses the heat and it makes your drying a lot quicker. Again, I dry a lot of towels, and I just add a couple of drops, sometimes lavender, sometimes orange, whatever I've got kind of going goes in, and it just adds to the fragrance of it. Rollables. I use these a lot in treatment actually, especially if a client has come in with a particular muscular ache or pain. If there's any essential oil left over from the treatment, I'll often put it in there, and then they can kind of like roll it on like the top of their traps, or if it's like a calf, they can use it on their calf. Wherever the ache is, then they can use that particular oil that's been blended for them in between treatments, and it just helps keep relieving that tension for them. But it doesn't have to be like a muscular ache to use a rollable. You can have it for anxiety, study blends. You can apply it to the wrist, the neck, wherever you're going to kind of incorporate that smell and use it, that's where you would place it. So it is super useful. One of my favorites I've left till last is steam bowls, a good old-fashioned steam bowl. Don't fix it if it's not broken. You don't need to do anything fancy. And it is what it is. It is a bowl you put in. Obviously, you use it probably more in winter time. You would just add a drop of maybe lavender or eucalyptus smithy. That will really help with kind of feeling coldy and thick and nasally. Just pop that towel over your head and take some really nice deep breaths, allowing that vapor to come right through the nasal passage down into the lungs, and then come up for some air and go back in. It's a super treatment. But like I say, definitely more of a winter thing. So how does an essential oil get to work on the body? So we can do this a couple of ways. So you've got 2 options topically. So this can be applied through a massage oil, a body lotion, an exfoliation scrub, a facial serum. Whatever you apply, it goes onto the skin. Secondly, it's through the olfactory system. So this is our sense of smell, and it's super important. The nasal cavity has a dual function. So the passageway, it's good for lots of things. It's got cilia in there, and it protects us from germs and bacteria. But particularly about essential oils, the passageway is for respiration and sense of smell. Now, we're talking about 2 very separate things that happen when you breathe in an essential oil. So the sense of smell, number 1, goes right up to the brain. And then you've got the substance taken in by the lungs and respiration in general. So in the first instance, the message contained in the oil molecule itself passed up to the brain. And then in the second, the molecules themselves are inhaled and with the incoming air, and they get carried into the lungs. And this is where a process called exchange of gases take place. And what that means is it enables the essential oils to be assimilated by the body tissues. And it sounds really technical, but all it means is your body then takes what it needs and it goes to whichever system it requires it to go to. So either situation is good. Breathing in the essential oils is the quickest way to get them into the body and the quickest way you can feel a benefit. I think I'd read somewhere it takes like 2 seconds for it to go into the limbic system, into the bloodstream. So it doesn't take long at all. So if you suffer with maybe anxiety or stress, other kind of mental unwellness there, inhalation is probably the most useful method to use essential oils. And like I say, it's the quickest way of getting it into the system and for you to feel those benefits. So the sense of smell evokes emotionally vivid memories more than any other sense. It's like a superpower. So if you've ever kind of passed maybe a bakery and you've inhaled kind of the aroma of the warm bread or the cookies or the cakes, whatever it is, that nice, sweet, warm smell, you know, that can take you back to memories, maybe childhood memories of baking with your grandma. Or maybe it's breathing in the sea air, that crisp smell, that kind of wet, salty smell reminds you of your family vacations at the seaside. Maybe it's the smell of Play-Doh. Does that bring you right back to first grade again? Or maybe it's the smell of small bonfires. Does that take you back to your traveling days or your hiking days? So you can see why they say smell can trigger emotions and take us back to a memory quicker than anything else. It's so important. And the power of smell is not only there to provoke memories and help us, but it's also there to identify danger. It's there to protect us. So, for instance, smelling a gas leak or smelling the milk to see if it's past its expiration date or if the food's gone rotten. That's there to protect you from stop eating or consuming those products that would make you really poorly. So again, sense of smell, super important. But if you didn't know, there's actually women have a stronger sense of smell than men. So in 2014, there was a case study done and it showed the number of cells in the olfactory region, specifically neurons, differ greater in men and women. And it was found, although the olfactory bulbs weighed basically the same, there was a 43% increase in the total number of cells in the female bulb. And I thought, well, that's just another thing we're good at, to be honest. So now we have a better understanding of what an essential oil is, how to use it around the home, and how it works within our bodies. So I'm going to move to slide 3. So what can we use essential oils to help with? Again, it's not an only list. There's lots of things you can add here, but again, in treatments, this is probably what I see the most or get asked the most to make or use. So we have got a lot going on and we can use essential oils for lots of different things. And like I say, this is just a small list of things. So let's have a look. So we've got at the top there, stress, anxiety, and depression. So we all live in a super fast-paced world, and sometimes it's really hard to get off. Recognizing our own stress and anxiety levels are huge and important. We need to know when we're going to burn out before we burn out. We need to know what those patterns are. And with this sort of trio, it's not uncommon to suffer with 2 of these or 3 of these. They often go hand in hand. study planning and preparation. So whether you've got exams, not necessarily school exams, accountancy exams, maybe you've got a meeting coming up and you've got to do a presentation. Maybe you've got to prepare a document and you need something on in the background. You know, rosemary and lime are super good brain oils to have. Perfumes, people like to make their own perfumes. I mentioned bath salts and bath bombs earlier. Really good combination, especially for the next one, muscular aches and pains. You don't always have to use heat for muscular aches and pains. You can, or I can make like a balm that you can put on like any particular area that's achy, could be the traps, could be lower back, kind of goes into PMS, that time of the month when you're really feeling kind of inflamed and bloated. There's a nice little rollable remedy there that you can just rub on your tummy and it will help soothe. In England, we're still going through our summer, hopefully. Not very summery today. Insects. So insect repellent is a super good one. Again, a lot of the store-bought insect repellent have a lot of chemicals in. So it's nice to use a natural alternative. So using like a citronella candle or like having the diffuser on with citronella in, lovely, kind of keeps those pesky flies away. Bruises, minor cuts and grazes. I've got 3 little ones and it is a daily occurrence for one of them to fall over and graze themselves. So I have a rollerball of lavender and tea tree, goes in our first aid box and we take that everywhere with us. And it's just a good, neat application and it stops that from kind of getting infected, helps it to heal a little bit quicker. What have we got next? Skin disorders. So essential oils, again, are relatively gentle if used in the right ratio. It can help with eczema, psoriasis, and then let's have a look, respiratory conditions. Like I mentioned, winter, colds, flu, asthma, you know, eucalyptus, peppermint, lavender are all really good essential oils to use for that kind of genre. Headaches, you know, a nice headache balm to rub on the temples when you can feel a headache coming on. You know, basil, peppermint are lovely oils to use. Fatigue and low mood can tie into stress and anxiety. They can fluctuate with depending how you're feeling. But you can definitely have a blend of essential oils that kind of uplift you and make you feel a bit more energized through the day. Menopausal symptoms, again, I'm seeing a lot more of this come through into the treatment room, you know, hot flushes, balancing of hormones. Again, lots of nice essential oils there to help with those sort of symptoms. And I've left sleep till last. And that's just because all of the above of that list will affect your sleep. Sleep is so important and it's so individual how much sleep that we need. And it's important we get a good night's sleep because it helps process things, it helps us heal. There's a lot of things that a good night's sleep will help. So as a clinical aromatherapist, if you came into me, what I would do first is I'd go through a consultation process. This is where I ask questions to find out how I can help you with essential oils. And there's always important factors to take into consideration. I'm a professional and I want to know this information just so I can make the best choices for you. So if we scroll on to things to consider. So age is an important factor, not because when you get to 67, you can't use essential oils. It means that I've got to adapt that blend to make sure it's not too strong for your skin type or your skin tone or your skin sensitivity. A full medical history is important to know. Have you had any recent operations? Are you going for an operation soon? Is that what you need the blend for, to be nice and relaxed? Medication, again, there's a lot of essential oils that can interfere with medication. So it's really important that I get a good idea of exactly what you're taking, how often you're taking it, and if you've been taking it for a while. So just making sure it's not a new medication. Allergies, obviously, we don't want you to have an allergic reaction. So it's important to know those bits. Occupation, again, what do you do on a day-to-day basis, like there's no point me giving you a bath salts if you work a 12-hour shift and you've got to take the kids to school and then pick them up. You can't fit that into your daily routine. So that's not going to work for you. The reason that you want this blend, you might have come in because you struggled to get to sleep, but actually, is it one of the top three? Is it to do with stress and anxiety? Is there something that I can combine to help all of those things together? Aversion to certain smells and triggers. Now, there might be an essential oil you can't stand the smell of. So I would need to know that to make sure that I don't use it, because if you don't like the smell of it, the likelihood is that you won't use it. And again, it can trigger different memories. So, you know, if your great grandma used lavender and she's recently passed away, I won't want to use that because that's going to evoke and bring up some trauma and some sad memories, and it won't make you feel very good using it. It will have the opposite effect. So they are important questions to establish right at the beginning. So what will happen now, once we've kind of gone through that process, it's not very often I make blends up there and then, but it does depend what it is for. I will often go away and it can take me a little while, a week to 2 weeks. And what I do is I go and research. I research the combination of oils to use, what to use it with, the best methods. I look at different case studies, clinical studies, you know, the latest information to make sure that it's going to work for you. And what blend of essential oils might work for one person might not work for you. So that's why, you know, it's very much bespoke to you and what you need and how you're going to use it, and the right method for you. So to me, research is a really key part and a thorough part of making sure you get the best outcome, and the best ratio, to make sure that it's safe for you. So ratios, let's talk about ratios. So this can get a bit complicated, so I want to make it as simple as possible. So let's have a look. So on this chart here, I've got two charts for you to look at. And don't worry too much. It's just so you can kind of absorb the information. So generally, as a rule, I don't, especially in treatments, if it's for a body oil that goes all over the body, I don't go above a 1% ratio. And that's for safety. That is for insurance purposes. And it makes me make sure that I do a good job and a safe job. You know, my priority is keeping you safe as well. So for instance, a 1% ratio in a 10 ml bottle is just 3 drops of essential oil. So lots of people think because it's a natural product, you can use as much as you like, but actually we still have to be really careful. These are why we have these guidelines to follow. So skincare, facial blends, babies, children, the elderly. I personally, for babies and children under 3, I would stick with a 0.5 ratio, but that's a personal thing, and the same with pregnant clients as well. You can see it goes all the way up to 100%, and that's for your vaporizers and your nasal inhalers, you know, the ones that you can pop up your nose. So the other chart we've got is just more of an easier, quick glance. I'm going to make a 1% ratio today, and I'm making 50 mils of a carrier oil, and you can get your drops there. So it's just important, safety. I know it sounds silly because they're essential oils, but it is important to make sure that we get it right. And the last thing I'd want is a high percentage, like a 3% or a 4% on the face. The face is such a sensitive area, and the skin is often thinner, so it absorbs it more. So yeah, it's super important. So let's look at some conditions. Let's see how they can help you. So I have got here, so skin conditions, eczema. So the blend I've put down here is for eczema, but just to give you a little insight, I had a client once who had a child and she had something called molluscum, and I'm not sure if you've heard of it. And it's not a very nice skin disorder. It's really aggravating for the child, and it lasts a long time and it takes a long time to go. And once you've got it, it can be easily spread to other family members. She was under Great Portland Street Hospital with a specialised dermatologist, and they couldn't really make it go away. She'd got in contact and said, I see you do blends. Is this something you could make? And again, very similar consultation, finding out exactly about the child and how I could help them. We ended up playing around with 2 different blends, and within a week it had gone, and she was a very happy mummy. She then went on to tell her dermatologist and said, you've got to get in touch with this lady. And so now at Great Portland Street, the dermatologist still now recommends people to come in and have some essential oils put on the body. Again, there's, aftercare advice to follow, and there's instructions. But it's a nice way of trialing something to see actually could an essential oil help me rather than a steroid cream. Now it won't help for everything, but it's a good place to start. So eczema, let's have a look. So the blend I put down here can help to relieve symptoms of eczema and other dry skin conditions. So you would use this to apply a thin layer on the affected area, and you can buy just plain body lotions or base creams, they're called. So I've put down cedarwood, German chamomile, lavender, myrrh and patchouli. These are a lovely collection of essential oils for a skin condition. And I've chosen them because they have good therapeutic properties. So cedarwood is a good antiseptic. German chamomile is very child friendly. It's good for chicken pox, but also good for sensitive skin, and it's an anti-inflammatory. Lavender, we all know, is a soothing one. It also has analgesic properties. Myrrh is an antibacterial and an inflammatory, so it'll help reduce any kind of redness. Patchouli, not everybody's favorite fragrance, but it's good at cell regeneration and moisturizing, and it also has that anti-inflammatory property in there. So again, it'll take that redness down. It will try and calm the skin. If we have a look at our next one, which is muscular aches and pains. So there's lots of options here. You can have it with your bath salts in the bath, heat and cold compresses. You can have it in a balm, in a lotion. There's lots of ways to kind of incorporate it. So we've got black pepper. Black pepper is a nice warming oil. Marjoram helps to relax the muscles. Peppermint, it has that antispasmodic, it is cooling, it has that menthol in there. Rosemary is a lovely muscular oil as well. It helps to ease pain and inflammation. But you do again have to be careful with medication in rosemary. Juniper helps with muscle tension. Lavender, soothing and pain relieving. And lemongrass, probably not one you would naturally jump to for a muscular ache or pain, but it is good for swelling and inflammation. Now, I've left the last one for mental health. It all hits us so differently and it affects each person different. So this is a general anxiety blend to use. And you can just add a couple of drops of this blend to a tissue. You can take some deep breaths and get that immediate relief. It can be made up into a rollable, and you can carry it around with you and roll it on your chest or your neck or your wrists. There's lots of ways to incorporate it. And the idea behind when you're feeling anxious in particular is if you have like an inhale, a quick, short, sharp inhale, it disrupts the brain. It will stop you thinking, oh, I'm anxious about this, to I'm being overloaded by this smell. What is this smell? And if you kind of use that as your go-to, your brain will go from being anxious to go, this is a nice smell. And it kind of stops that pattern from forming. So it's a really good tool to use for anxiety. So let's have a little look at the oils we've got here. So we have got cypress, lemon, and bergamot, lovely oils to use. So a cypress can help restore calm. It's good for the nervous system. It's more often associated with kind of lymphatic work and water retention, but it is good. It's a nice tonic. Lemon, not probably one you would associate with anxiety, but it's actually an antidepressant. It's very uplifting. Bergamot, I love bergamot. It's one of my favorite oils. It is calming, it is relaxing, it's sedative. It has anxiety properties, anxiety relieving properties in there. So it's a really good one to use. And like I say, there's different tools there you can use it with. And I think with the fast-paced world, you know, it's one of those things that we just kind of learn to live with a little bit. And if we can help in any way with a natural alternative, then it's a really nice place to use it. So, Helen, thank you very much for asking me to come on today. And as always, if you have any questions, please feel free to reach out. I'm more than happy to answer any questions. And thank you so much for your time today.
Oh, thank you so much, Laura. I know, well, I learned a lot there, and I'm sure other people did too. And you know, I'd forgotten you telling me about the hospital. And so, you know, just for the American viewers, I should say that Great Ormond Street Hospital is kind of, you know, really on the equivalent level with St. Jude's here. I mean, it is like probably one of the most famous hospitals in England. They do some amazing work. So to have a child have gone in there and you could have helped them with their skin condition as you did, and then want to know more about it is just, that's just incredible. Yeah. A lady called Jennifer was asking where she could get the recipes for all your great ideas, and I'm not sure where we were on the video where she said about the recipe. So I'm going to let me see. Jennifer, either pop in the comments like right now, or reach out to Laura on the connect on the link button I provided there, so you can come out and check with Laura, because I'm sure that some of this is a little bit customized as well. So
100%, yeah.
Someone very, you know, even more specifically, which would help them even more. I didn't know women had a stronger sense of smell than men.
I know.
So why are we changing more diapers? That was really my question. I'd like to know that. So men need to be changing the diapers. This is why. Okay. But yes. And Laura, tell me how you got into aromatherapy in the first place. What led you to it?
I actually wanted to be a child pediatric nurse, and I was at secondary school and I was finishing my exams, and it was my head who actually said, "Oh, you're not clever enough to be a nurse." And I was kind of taken aback, and I thought, I don't know what I want to do. That's kind of a blow. And I'll cut a very long story short. I fell into beauty very quickly because I thought it's a way of helping people, making them feel better. And whilst I was doing that course at college, I stumbled across holistic therapy, and I studied holistic therapy there, and I just kind of fell in love with it, really.
I think that is incredible. I think they were wrong, but you know, but I think this is incredible that you've ended up in this and that you use it and customize it. That's what I love about the holistic field. It's using to customize for exactly what will help that individual person. And it's seeing that individual person as an individual, not just saying, oh, well, you're the next one in line, have the same as the last one. It's really seeing them, and just, you know, still on the screen right now, you've got the mental health blend. And, you know, and I was, as I was saying to Raquel just a minute ago, it's just any gift that you can give someone which is going to help them at just that moment in their day, to help their day go a little bit better, and to help them get over just that little, you know, wherever they are right now before it spirals into something worse. This is such a tremendous gift, you know, to be able to help someone to do that. I think that's because anxiety is such a thing. I mean, it's linked to hormonal changes as well. Yeah, so it's just, it just affects so many people. So yes, so take note of this, everybody. Get your own rollerball blend. I want everyone with a rollerball blend in their purse by the end of the week. I want everyone sniffing as they go through their day.
Yeah.
And keep track of how it helps. And if one oil, like you say, doesn't work for you, then try another one. But I do love it. Okay, so let's see if we've got any more questions. But if not, reach out to Laura. I put her contact details in there, and she will be happy to talk to you. So thank you so much, Laura, for coming and talking to us and sharing all your knowledge. And I'm sure
thank you so much.
Reach out and contact you. So let me hit end right now. There we go. And